It doesn't fix it. It gives you relief. So that's the difference. All right? Now, what else? Once you get the digestion working properly, you have the leaky gut repaired, or you're in the process of doing that, you have the immune system working correctly, then you can go through desensitization. And there are different ways of doing this. Now, the medical people will give you shots in the skin and things like this to desensitize you. They're trying to get the body to quit reacting like it is. We do some things that are similar. We don't give you an injection. We have, at least in this office, 4 different techniques we can draw on to help stop allergy responses to the body. Some of them, most of them, are like the combination of oriental medicine, along with the acupuncture points, laser therapy, also what we call energy medicine. How many of you here have heard of NEAT? It's an energy technique developed by a woman doctor, been around for quite a while, and it's an energy technique. And it's some folks think it's kind of hocus pocus, but it works. It'll help stop allergies. It can be fairly involved. The form that I use of this is called neuromodulation technique, NMT. It's a little simpler, easier to do, same kind of result. It's an energy system type thing where we're using, it's kind of esoteric, I guess. It's a little bit, it's what I call the Harry Potter magic techniques, that kind of thing, but they work. I've seen people literally with anaphylactic reaction type of, they would, if they got exposed to a certain food, they'd have an anaphylactic reaction which would kill them. I've seen those people actually taken, run through an NMT protocol, which takes all of about maybe 10 minutes, maybe 15 minutes, possibly 20 if you're really digging around in there. One treatment, they come out with the foods, person eats it, no reaction. I've seen that happen, so I've watched that film. And I was at seminars where they do that. I've looked at NMT seminars that do that regularly. And it works. Now, how it works is really kind of strange. I'm not real sure, but it works. I had a patient who used to get big old hives on him every time he ate garlic. We found out there was an emotional tie-in with that. We had some very bad experiences when he was in another country eating a lot of garlic, and his brain hooked up with this. So he ate garlic to break out his hives. We ran him through the NMT procedures. If you eat all the garlic at once, it doesn't affect any wounds. Okay? But it's through an energy technique. We're not giving you a supplement, we're not giving you a drug, we're not giving you a homeopathic. We're just trying to get the body to quit it. And we do that basically by, in the case of NMT, we talk to the body, which is really weird. But that's how it's done. It's done verbally. But I've seen it work. And it's just the oddest thing I've ever seen in my life. To this day, if I do this technique, I still think it's just weird. It works. That's all I care about. And these people get that, and and the allergy generally never comes back. They've tracked these people for years. And they don't have it come back to them. So these are some of the things we use. We also use some other techniques. We use, like here it says, quantum neurology rehabilitation technique, neuromodulation already mentioned, and the accelerated allergy clearing technique. These are done with a combination of laser and acupuncture, or sometimes we use electrical stim on the acupuncture points. But these are ways of getting the body to somehow recognize that the allergen is no longer a threat to it, and it quits reacting. And they work. Now, if we use those first, sometimes because you haven't repaired the rest of the whole system, you resensitize it. So you need to do both. You need to kind of get the gut repaired, get the digestion working, have the immune system working properly. Then you desensitize it, it sticks. Okay? Now, occasionally with NMT, at least the few that I've seen, you didn't have to do these other things. It just fixed it. That was it. I'm not sure why it does that. Now, it's not to say you couldn't go or do something else. Okay? But these methods are available and they work. And they work well. So that's how we deal with it here. And that's how a lot of other alternative healthcare doctors are familiar with some of these other things, and they all understand these concepts. You don't want to be living off of Benadryl and living off of, having to have allergy shots all the time and all these other kinds of things. That makes life miserable. It's expensive. It's not real comfortable to get these kinds of treatments sometimes, especially when they do injections. And what I want you to understand tonight is that there are options to these things. You don't have to be allergic. But the idea is get you healthy. If you're healthy enough, you don't have disease. Okay? It's almost silly to talk about this, but that's what it is. If you're healthy enough, there's no room for illness. Because illness is an end result of a breakdown of one or more systems in the body. Then you get these things we call symptoms and signs and stuff. You get your illnesses. But they don't occur if you're healthy. and they go away if we can restore health. Okay? Any questions tonight about anything we've talked about? All right. So that's all I have for you. I hope you enjoyed it. And we'll let you know when our next lecture is and the things we'll be talking about, and you'll be informed of that. So just kind of check the website. Jessica's kind of taken that over for us. She did a superb job. And we really appreciate the work she does on that. And we'll let you know what the next one is.
What is your website again?
It's